go through this, and then we'll call it a day. So, what's the most common symptom of Gardnerella vaginalis? No, I think you're playing.
You said no? To what?
Most common cause.
Oh.
B? C. Vaginal discharge with a fishy odor. That's correct. Here we go. What is the etiology or the common for the common cold? D. Rhinovirus. You can see that this was part of an exam. It might be there again. Who knows? Cholera is a toxigenic dysenteric disease common in many parts of the world. In the treatment of individuals who have cholera, you would. This is assuming that you've already watched the video for the GI. That's why you looked guilty earlier. You could have done what's supposed to happen. What's the answer? C? No, B? B is correct. You provide palliative care with replacements of electrolytes and fluids. You have to get them rehydrated again, because if you don't, if you just give them antibiotics, it's going to cause endotoxic shock, because it's a gram negative, all of the endotoxin will just wreak havoc on them. Mm-hmm. You have to get them rehydrated, then you start antibiotic therapy. Because with cholera, you can lose up to a liter of water in an hour. Damn. And it's when you poo, it's just like, there's nothing there, right? Just water. Okay, here we go. In epidemics of legionellosis, what is the usual contributing factor that causes the epidemic? B. Water. You could take this already. Here we go. Although Clostridium difficile is an anaerobe, why is it able to survive for such long periods of time in a hospital setting? Endospores is correct. Staphylococcus aureus causes a wide variety of infection, ranging from wound infection to pneumonia. Treatment of Staph aureus infection with penicillin is often complicated by the B. The production of penicillinase, which is beta-lactamase. Which that's an enzyme that breaks down penicillin, doesn't let it function. Traveler's diarrhea is associated with which type of E. coli? Which one? Not B, that you're playing. C, no, that you're playing. E is correct. So there's a lot of types of E. coli. The only two you need to know for me for the exam are EHEC, enterohemorrhagic E. coli, which causes hemolytic uremic syndrome. Big time, 20% mortality for anybody who gets it. The other one is ETEC, which is traveler's diarrhea. Okay? Only two. The others will be there, not the answer. Do not answer those. Okay, here we go. The etiology of septicemia is sometimes referred to as rabbit fever is? Francella. Correct the number. Here we go. Pyoderma is an infection that affects what tissue? Skin or integument. Okay. Syphilis is caused by which etiology? Which one? B, treponema. Correct. Neurotoxins play a role in blocking of acetylcholine in diseases caused by? We just talked about it. Clostridium. All right, so I sometimes give an exam as an online, right? Especially when I used to teach online. So I came up with these PowerPoints, and they have lots of clues, and all you have to do is tell me what the answer is. Yes, it's kind of like a puzzle. It's fun. It's a really good way to study, because then you learn the symptoms, you learn about the infectious disease. So let's see if you can tell me what these things are. Yes, you ready? Here we go. So what are you looking at? What's the etiology? Huh? Group A strep. Streptococcus pyogenes. right? Catalase negative, you see coccygeal chains, impetigo, pharyngitis, here's an A disc, you have sensitivity of an organism that's beta hemolytic. That's necrotizing fasciitis. Okay? Here we go. Boom, tell me.
Zika.
No, Zika. This is Zika. Alright, here we go. Boom. Huh?
Oh, I just said the plague, but I
Not the plague.
Not the plague.
Although some people might call it the plague, it's not the plague. This is the mask I was talking about. The duck mask, yeah. What is it? Mycobacterium tuberculosis. It's acid fast, right? Here's the neuration. You can see the lower lungs, the lower lobes of the lungs are infected. Okay? All right, we just talked about this one. What is it? No, not encephalitis. Take your plan. Tetanus. Clostridium tetanus. Oh, looky here. We just talked about it. Polio. Polio. Clues are easy. No, not malaria. Malaria is going to be mosquito borne. And, huh? Which pneumonia? What's the etiology? Here's a hint right here. Legionella. Legionella pneumophila. Very good. Here we go. We just talked about it. Prionic disease. Oh, this is an easy one because you know it's right there. Giardia. Oh, everybody knew this one. Okay, here we go. Oh, this is not fair at all because I didn't even. I mean, I talked about it, but I didn't give you the symptomology. This is Haemophilus ducreyi, and I would never ask you this if I didn't talk about it more. Okay, what about this one? So the way you think about these things, especially when you do case studies, you think what system of the body is causing problems, and those are the organisms you focus in on. So what system of the body is here? The lungs, so the respiratory tract. So now, what are you looking at? Are these bacteria? No. Are they yeast? Yeah, they're yeast. This is Pneumocystis jirovecii. Dang, girl. All right, here we go. Oh, this is easy. We just talked about it. Huh?
Oh, never mind.
I hate mini pots. I hate them. What are you looking at? An amoeba. So this is either a acanthamoeba or Naegleria. Alright, now here we go. Oh, this is kind of hard. Let's see if you can get there. Hamburger meat.
Is it milk?
Cattle. Oh, looky there. The kidneys are involved. What's that? E. coli. Nice, Annalisa.
Look at the kidney.
Yeah.
Yeah.
This is pus. This is EHEC. That's what this is. Okay. Well, this is easy. I want a mask.
There we go. Now we got it.
Yersinia pestis. Right. This is easy. There he is. He wants to kiss you. Chagas disease. This is Trypanosoma cruzi. And then this is easy. What do you see? Pseudomembrane. Bull's neck. Maria? Don't ask me. I'm not been feeling good lately. This is Corynebacterium diphtheriae. This is diphtheria. Okay? Okay, we did this already. I got a couple of other case studies for you. Here we go. So I think you know what this is really easily, right? So unfortunately this won't be one because we're not doing the skin. We're doing either respiratory, urogenital, or systemic. You're not gonna get a case study on the skin, right? Since you are here and decided your class is different, since you're here, I'm gonna tell you, we have one respiratory case study and one systemic. You had one respiratory and one systemic. You should have cats. Cats. Okay? Everybody else should know ticks.
Cats.
I'll just give you a big hint, girl.
Or ticks.
Don't be giving me that kind of look. Okay? Alright, so a 16-year-old female high school student presented with superficial lesions on the face and torso. The patient recently returned from summer camp working as a counselor in a summer camp for underprivileged kids from inner city environments. Many of the kids from relatively impoverished families do not practice good personal hygiene. As a result, many of them have minor skin and scalp problems. The patient's duties at the camp included supervision of swimming classes and other outdoor activities. She also served as a recent supervisor in one of the cabins in which the kids slept and showered. Right. On examination, the patient found to have several distinct, roughly circular lesions on her face and torso. The lesions range from 2 to 8 centimeters in diameter. That's pretty big, right? And have well-demarked edges. The edges of the lesions are highly inflamed where there is little or no inflammation in the center of the larger lesions. The borders of lesions are scaly, recently raised, and noticeable reddening. The centers of the lesions are hypopigmented, and they don't have very much pigment. The patients, it should be stated that the lesions first developed about 3 weeks earlier of having been enlarged, spreading since that time. They are quite itchy, but not painful. The lesions appear to be superficial, affecting only the cutaneous layers of the skin. The patient is said to have been using topical antibiotics and corticosteroids for the last 2 years. Yeah. The patient's vital signs are normal, and there are no other remarkable physical findings. The laboratory finds the lesion provide clues to the etiology. What is the etiology? Microsporum, or you could say tinea, that's fair, right? What route does this infection agent use to get in the body? Contact. Mm-hmm. What part of the life cycle causes this infection? The spore. And then the patient is a cheerleader and part of the ladies wrestling team. What advice should she follow to minimize the transmission to other members of her sport? Don't wrestle. Do not come in contact with your other mates until it's resolved, right? Because it's highly contagious. Okay? So here's another example of kind of the questions and the answers you might see. I have another one. Let's do, no, this one's even easier because it's that thing right there and you should know what it is already. A patient was 26-year-old Peace Corps volunteer who 2 weeks prior to seeking medical advice returned from a 2-year assignment in Togo. His past medical history was significant for his developmental malaria during his assignment. This occurred as a result of his continuing malaria prophylaxis after developing acute dysentery. The patient noted that the Togo assignment was to help develop infrastructure for purifying water and septic systems. The assignment was located in an area that was underdeveloped and contained a large indigenous wildlife population. The patient's assignment was successful. After 2 years, the patient provided a photo of drinking water from what he called a clean source.
Oh my God.
At presentation, he complained of chronic diarrhea for previous 4 weeks. His diarrhea was accompanied by cramps, abdominal pain, and foul-smelling flatulence. The diarrhea occurred soon after meals, like 30 to 60 minutes after eating meals, and he complained of some nausea following eating. He denied having any fever or chills. So, with no fever or chills, it's not bacterial, right? On physical examination, he was somewhat chaotic and claimed he had lost had a 20-pound weight loss. The 3 stools were examined, all were negative for enteric bacterial pathogens, however, a trichome stain is the way we stain for protozoal parasites, revealed the etiology of this diarrhea. What is the etiology of the infection? Giardia. What route does the organism get into the body? Fecal route. What part of the life cycle causes the infection? Be careful. Huh? No, the cyst is how it gets in. That's why I asked you to be careful. The trophozoite is what causes the infection. The cyst is how it gets in, right? And then what could the patient have done to minimize the opportunity to contract the infection? I promise you, if you have studied what I've asked you to study, that the 2 case studies are really fair and you should be able to answer them. Okay?
How much are they worth?
10 points each. So that's 40 points there. I mean, that's 40 multiple choice, 2 points each, that's 80, and then 2 10 points. And then you can get 5 if you go to the symposium. If you can't go to the symposium, you go to an SI session or you study in a group, you can get 2, but not 5. Okay?
So if we do both, we can get.
5
Wishful
is the
thinking.
maximum.
Still pretty good.
It's real good. Come on, girl. It's real good. Anybody have any questions?